Hello, welcome back again to this channel. This is Grapham Academy. Today we are going to look at a new lecture, and that is drug interaction. And before we start in with what we need to learn today, I need to take you through something small, and that is a brief story or experience that I got or that my friend told me about. So, and it is in line with drug interaction. We see that a patient by names that I may not disclose, had always been a healthy person. But in the past years, she had been managing a few health conditions that were affecting her. So she was prescribed with medications for high blood pressure and others for her anxiety. Over time, she started experiencing a variety of strange symptoms on her. And then a dizziness, nausea, an overwhelming sense of fatigue. Like you can always have fatigue, but should not be overwhelming. And if it is overwhelming, it can be an underlying condition. So at first, she thought it was stress from her busy job and maybe lack of sleep because her work schedules had changed and she would not have enough rest. But as the days went by, her symptoms only worsened. So one afternoon, this patient visited a health facility for checkup. After sharing her concerns, excuse me, about the persistent symptoms, her professional healthcare provider asked her to bring all the medication she has been currently taking. So as the medicines were placed on the table, the doctor was surprised and told her, "It looks like you're having or experiencing drug interaction." So Maria was confused and was wondering what is drug interaction. So she asked, "What does that even mean?" So the doctor had to explain to her what it meant and also told her that the blood pressure medications that she was taking can lower her blood pressure, while the anxiety medications have sedative effects. That's why she's experiencing like fatigue. So together, this causing your blood pressure to drop too much, leading to dizziness and other symptoms that you are experiencing. Okay, so Maria felt a sense of relief knowing that her symptoms weren't a sign of something more serious, but she was also alarmed. She hadn't realized how important it was to consider how medications could interact with each other. So today we are going to look at drug interaction. So when you look at Maria's story, there is need for you to know drug interaction. You need to be well conversant with it. Either you are a patient or a healthcare provider, you need to have an idea because this can affect your patient and your patient can present with other symptoms, and if they do not explain to another healthcare provider whom they will interact with that they are under some specific medications, you find that your patient will be given more medications to treat the alignments that they are facing. Okay, so let us look at the outline we have today and see what we need to know. So you need to define what drug interaction is. You need to know the definition of drug interaction. You need to know the clinical relevance. And then you need to know the different types. So factors predisposing to drug interaction, and then what is the impact of drug interaction. So how do we define drug interaction? Drug interaction occurs when the effect of one drug is affected by the presence of another drug, or food, or drink, or an environment chemical agent. So we see that alteration of the effect of one or more drugs or the production of the idiopathic effect can be adverse drug reaction. I mean, drug interaction, please. Sorry about that. So what's the clinical relevance? Identification of the factors affecting the risk of the drug interaction, You need to have identification of the patient likely to be adversely affected by drug interaction. So, what are these factors affecting the risk of drug interaction? We see that there is polypharmacy. This is the more drugs a patient takes, the greater is the likelihood of a drug to interact. Then there is organ functioning of a patient, particularly the liver and the kidney are going to be affected because they are going to be overworked. We all know that metabolism and excretion majorly takes place in these organs. Drug administration, what's the route of drug administration that you're using, can also be a risk factor of drug interaction. Duration of the therapy, how long is the medication a patient is taking? Then number of prescribers for a particular patient and their level of coordination. So sometimes when you have so many prescribers assigned to a same patient, you may find there is no coordination unless these prescribers sit together and discuss together. That is when there will be reduced risk of adverse drug reaction. What is a patient likely to a patient's likely to be adversely affected by drug interaction? Those that are elderly or seriously ill patients can be affected. Patients on long-term therapy in chronic diseases, for example, HIV/AIDS patients can be affected by this. Not only HIV/AIDS are those patients that are long therapy, there are also those other medications. Maybe, for example, the example we have just given about a patient on high blood pressure medications or hypertensive medications. You see that it is also a long-term therapy. Okay, a patient undergoing complicated surgical procedures can as well experience interactions. So, what are the types of mechanisms of drug interactions? So, there are two mechanisms of interactions. It can be pharmacokinetic interaction or pharmacodynamic interactions. So, this is majorly expounded on a course unit called pharmacology, where you are taken through what pharmacokinetics is and pharmacodynamics is. So when you look at pharmacokinetics, one drug affects the process by which the drug is absorbed, distributed, metabolized, or excreted. So you see that this is what the drug does to the body, whereby one drug affects the process by which the drug is absorbed. Your body has to absorb the drug. Your body has to distribute this medication. Your body has to metabolize it and your body has to excrete it. So there is an increase or decrease in amount needed to produce the pharmacological action when this is affected. Okay. So what about pharmacodynamic interaction? So these are the interactions between the drug which have similar or antagonistic pharmacological effects or side effects. So you find that they are competing for the same maybe active site, for the same receptors in the body. So this competition can lead to interactions of these medications, and a patient is able to present with other symptoms as a result of this interaction. They may be due to competition at receptor sites, like I'm saying, or occur between drug acting on the same physiological system. They are usually predictable from the knowledge of the action of this drug, the therapeutic action of the drug, and the physiological sites that they may bind to. What do you need to have in mind? You see that the object drug, one whose activity is affected by an interaction, that's an object drug. What about the or precipitant drug? Is a precipitates, it's a precipitates or precipitates the interaction. So when the interaction takes place, you have to administer what they call a precipitant drug, which is going to precipitate the what? The interaction that is occurring in the patient's body. So when you look at the pharmacokinetics effects maybe on absorption and what happens on absorption exactly, we can see complexation and adsorption, or alteration of the GIT pH. This is the gastrointestinal pH. There can be also alteration of the GIT microflora, the dioxins, or we can also see there will be change in the GIT mortality. Okay, like the movements in the stomach may change, emptying and what absorption. So most of the oral medications may be absorbed enterically in the stomach. Okay, so under absorption, that is what some of the things that are likely to happen. So under distribution, we see that there is displacement on protein binding or relative affinities for plasma proteins. One drug can displace another, thereby increasing its proportion to diffuse form for plasma to its self of action, or to its sites, to its sites of action. So you find that you need to know this so that there is no displacement of protein binding sites. You know, most of the receptors are protein in nature, or enzymes are protein in nature. So when there is displacement of these binding sites, it can bring about interaction, and that interaction can be classified majorly under pharmacokinetic type of drug interaction. So what about on the metabolism? You see that many drugs are metabolized in the liver. That's why in the previous slide we talked about organs that can be affected, and we talked about the liver and then kidney. Okay, so induction of hepatic microsomal enzymes by one drug can gradually increase the metabolism of another drug. So inhibition of this hepatic microsomal enzymes by one drug can gradually decrease the metabolism of another drug. Okay, so you find that there is need for you to understand all this so that you don't affect the system. What about on renal excretion? Excretion majorly happening on the kidney or on the renal system in the body. So changes in the active tubular secretions can take place, and then alteration in the urine pH, and then alteration in blood flow can take place, and competition occurs between drugs which share active transport mechanisms in the proximal tubules. So we need to appreciate the renal system. That's why we always start with biomedicals, where you're taken through the physiology of those systems, the anatomy of those systems, and you will be in position to appreciate as you go on in your study. So I hope that we can appreciate what a proximal tubule is, what physiological activities take place in the proximal tubule of the renal system. Okay. So what are some of the drugs or substrates inducers that can bring about interactions? So these are some of the examples. In your free time, you can pause this slide and have a chance to know them. The same happens here. You can pause the slides and then you go through it. Okay. So when we look at the pharmacodynamics adverse drug effect, we see that pharmacodynamics affects or effects may be antagonism or agonism, addition or summation. They can be synergism or potentiation. Okay. So what are the important pharmacodynamic interactions that can take place? These are the drugs, interacting drug, disease states, and then mechanisms and effects. So this is also an example that you can pause and view in your free time. So what are the factors predisposing to drug interactions? That's what we are going to look at. So there are clinical sources that we looked at already. Some of them, we said polypharmacy, and then a narrow therapeutic window, that TW is therapeutic window requiring careful dose control. And then we shall have drug, either an inducer or inhibitor of liver enzymes, and then used for a long period of time. We can also have drugs which exhibit zero order kinetics. What about patient factors? What can be the issue that can predispose them to adverse drug reactions, irrespective of the type of adverse drug reactions? We have multiple drug therapies, severe illness, organ functioning of a patient, the age can be elderly or young, comorbid patients, and then genetics. What are the impacts or outcomes of adverse drug reaction? There will be loss of therapeutic effect of one or all the drugs that you are giving this patient. There will be increased pharmacological activity of one. It can also bring about increased toxicity of one drug, or can also lead to organ dysfunction. So what is the counteracting drug interactions? So we see that practitioners should be continually alert to the possible or possibility of drug interaction and take appropriate steps to minimize their occurrence in the community or in the society or in the patients that they always treat. In case the combination of a potentially interacting drug is unavoidable, the dose of the drug is likely to have increased effects. As a result of interaction should be reduced, and the management of these side effects or of interaction should also be taken into consideration, and then avoid concomitant combinations. And then individualized patient therapy, very important. Patient education should be very key. Always ask for non-prescription medications, and then modify dose for one of the interaction or interacting medications. If the patient is taking a combination of potentially interacting drugs, should be monitored for toxic effects using clinical variables, for example, or plasma drug levels for at least 2 weeks to utilize until they are stable. Like, you have to monitor these patients until they are stable, because at the back of your mind you already know that interaction is going to take place between these medications. So monitor your patient always to make sure that a condition or the symptoms do not over exhalate them. It may be appropriate to switch one of the treatment to one which doesn't interact. Homework for you. We see that the mechanisms of drug interactions with examples, you can state them, and stating the objective drug and precipitant drug in each case. Okay, thank you so much for listening. This is Africa, more specifically the Pearl of Africa. We are joyful people, and you can visit our country anytime because it is filled with nature and so exciting. I am so happy to have taken you through this specific lecture on drug interaction. Please, if it is your first time listening to this video and you have come this far, thank you so much for listening, and stay tuned for more. This is Grapham Academy. We love you, we care for you, and we look forward that you excel and deliver the best of your service and be more skilled to deliver the best to the community. We wish you all the best. Stay tuned.